Hi, everybody. I'm Nicole Kristal. I'm the president of Still Bisexual, and I'm here as a representative of the Out for Mental Health program here in California. And go ahead.
I'm Josue Vega. I'm here with Strength United's Pride United program, and I'm also here on behalf of the Affirming Mental Health Task Force.
And we are lucky enough to have a representative from the LA County Department of Mental Health here today to speak with us about how COVID is impacting communities, particularly communities who are LGBTQ+. We are with Rebecca Gitlin. Rebecca, thank you so much for joining us.
Of course, thanks for having me.
If you could just start by describing a little bit about what your role is at DMH and how you work with LGBTQ people.
Sure. So I am a clinical psychologist by training. And recently, just before stay-at-home orders actually were put in place, I started working for the department as the first LGBTQ+ services specialist. This is the first time that the department has had a staff position that is specifically dedicated toward improving and evaluating existing services for LGBTQ+ communities, and also expanding our services to be more culturally responsive. So we have many different programs within the department. Some have LGBTQ+ specific services and many don't. So part of my job is to build that out.
Gotcha. So let's just start with a little bit about what the DMH is doing regarding mental health and the services they're providing during COVID, and then we'll get more specifically into what they're doing for LGBTQ people during this time.
Sure. The department has instituted a couple of different avenues to reach out for support. Some are more formalized treatment and some are not. So one is that the department has a warm line that folks can access if they need somebody to talk to, but aren't necessarily in a state of acute crisis and don't need like immediate emergency assistance. Mm-hmm. So that warm line can be accessed through our general DMH access line. And it's a place where you can talk with a trained peer who can help you walk through some of the distress that you may be experiencing. And can also help with referrals to more formalized treatment if that's something that you're looking for. We also have instituted a speakers bureau, which is a group of licensed clinicians who serve as ambassadors for the department. And Speakers Bureau ambassadors will partner with community-based organizations, and many of which are not actually formal mental health organizations. So faith-based organizations, for example, or other kind of community organizations where someone from DMH can come and give a workshop or give consultation or provide some direct and temporary support to folks in whichever community is calling out for that ambassador. And the last thing that the department has done that I want to speak about is we have maintained a partnership with the app Headspace. And through that app, anybody who lives in Los Angeles County can get access to a premium subscription for free through the end of 2020. So the Headspace app, if you're not familiar with it, has lots of great recorded scripts and just different kinds of exercises to help folks increase their utilization of mindfulness techniques and other kind of grounding and relaxation approaches that can help through this time and any other time.
Great. And what LGBTQ specific mental health services is DMH providing or aiming to provide in the future, either regarding COVID or just in general?
Yeah. We don't have anything specifically COVID related within LGBTQ plus mental health initiatives as of yet. And like I mentioned before, part of my position is aiming to build out the services that we already have and increase services that are available for the LGBTQ plus community. For example, one of the things that we are doing is we're instituting a new clinical role that is going to be available all throughout the county and for all age groups. And that new clinical role is going to be the gender affirming treatment advocate role. And these are going to be specially trained clinicians who are able to work with trans and non-binary clients to help them access whatever kinds of treatments they may want or need for gender affirming services. So that's one of the newer initiatives that we're doing. And we are also looking to create an LGBTQ plus champion network within the department. And so that will be a couple months down the line, but this is going to be a directory of folks who already have specialized training and expertise in working with LGBTQ plus folks, so that community members and other providers within the department can access them for referrals, direct treatment or consultation.
Well, it's wonderful the department's finally creating that so LGBTQ clients can know where to go to have their identity affirmed. That's fantastic.
Yeah, and these are all at the beginning stages, but this is part of my vision for the department.
Great, and you came up with that yourself?
It was inspired by other health systems that have had similar mechanisms in place, but yeah.
That's wonderful.
Yeah, thanks.
I'm glad it is. Thank you. I think I will lead on the next question now, which is more of an individual, each person viewing this. How can a person self-assess whether they're experiencing depression or anxiety? And when is a good time for them to know when to reach out for support?
Yeah, that's a great question. And a lot of it really depends from person to person. I think part of what our current reality is that I think many of us are experiencing more depression and anxiety than we otherwise would. And that in some way that has become our new normal. In terms of when we know when we need to reach out for additional support, that's when we're starting to look at what changes are you seeing that are really difficult to kind of unhook yourself from, or things that are really sticking around most of the day, most days of the week for 2 weeks or more. That's kind of our pretty standard clinical parameter around that. So looking at things like your mood, are you feeling down? Are you feeling depressed? Are you feeling just kind of numb and blah for most of the day, most days? Are you feeling a lot of worried or restless thoughts that you can't seem to move away from? And is that sticking around for several weeks at a time? And we're also looking at difficulties kind of maintaining your daily routine and daily health practices. So are you having trouble maintaining your hygiene practices? Are you having difficulty remembering to eat or eating a balanced diet to the extent that you have access to a balanced diet? Are you seeing differences in your relationships with others, either totally isolating from folks? Are you seeing increased conflict? And so some of these may or may not be signs of depression and anxiety, but they can also just mean signs that you can benefit from some additional support, whether or not you are experiencing what we would clinically diagnose as depression or anxiety. And one thing that I think is really important to access internally is a sense of hope for the future. There's a lot of uncertainty and just a lot of pain that we are experiencing as a collective. And if you are not feeling like you're able to tap into a sense of hope for what comes after this, that may be a sign that there's something to get some additional support around. And if you are having any thoughts about hurting yourself or increased thoughts of death or dying to the extent that you are at increased risk for doing something from those thoughts, then I would absolutely encourage you to reach out for some support.
Thank you so much. I really, Peace on Hope is really big. Having you here speaking on behalf of the LGBTQI plus community itself is really hopeful. Which brings us also to our next question. With hope and finding affirming services, how can a person ensure that the provider they are seeking support from is LGBTQI plus affirming?
Yeah. So there are kind of two different approaches that someone can take to this. One is before even meeting the provider. A lot of providers, whether they're part of a community organization or in private practice, have some kind of web presence. So many providers will indicate and should indicate if they are LGBTQ plus affirming, they should indicate that on their website. So part of it is kind of doing some sleuthing on the web if you have access to the internet to do that. And especially on some therapist directories like Psychology Today or Therapy Den, you can kind of check a box that says different communities that you have expertise in, that you are specifically affirming towards in your practice. So even before meeting a provider, you can get a sense of that. I also recognize that especially within a system like DMH, you don't really have access to that from individual providers, to which I would really encourage people to ask. You know, when you go in for your first appointment, they're asking you a lot of questions about your background, and you have every right, and really you should feel empowered to ask them similar questions about their background. So you can ask, what is your training in working with people who share my identity? What kind of experience have you had? Do you even know what LGBTQ plus affirming care means? And if they don't, then that is probably a clear sign that, you know, you might want to look into other options.
Thank you so much. I love this. Like, I think being empowered in your own therapy session is such a great tool to carry. I think Nicole is going to ask us the next question regarding access to insurance.
Yeah. So as we all know, insurance is going to the therapist is expensive, and a lot of therapists don't take health insurance. So how can a person get support if they don't have insurance coverage, or they don't know how to navigate their insurance, you know, such as Medi-Cal or their private plan?
Yeah. So two larger systemic avenues that folks can look into are, one, the Department of Mental Health has an access line that provides crisis response, but also provides referral assistance. So people can call our access line, which is 1-800-854-7771, and talk to the person on the other side of the phone to ask questions about insurance. And if they don't have insurance, lots of DMH clinics have people on site who can help people sign up for Medi-Cal if they're not already. And depending on someone's income level, people can access services through the Department of Mental Health without even having Medi-Cal if they fall below a certain income threshold. But we know that a lot of people are kind of underinsured, where they have health insurance in the technical sense of the word, but then the deductibles or the premiums are, or the co-pays are to the extent where they can't really afford accessing mental health services. So for that, the department can work with people as well. And the access line can also provide referrals to lots of low cost or free resources in the area that are outside of the Department of Mental Health. Another great avenue for finding different resources and referrals is the National Alliance on Mental Illness, or NAMI. And they have lots of information on their website, which is nami.org, N-A-M-I, or their hotline is 1-800-950-NAMI, N-A-M-I. The other thing is, many folks may find it challenging just to navigate their insurance once they have it. Lots of health insurance cards will have a specific behavioral health hotline. So if you check out your health insurance card, you can hopefully call and then be able to find what different providers are within your network that can provide you with ongoing services. The other thing is, lots of therapist directories. I mentioned Psychology Today and Therapy Den as two of the main ones that folks go to. They have options to filter out your health insurance, so you can pull up only providers that see people that have your health insurance. For LGBTQ plus folks, lots of LGBTQ plus organizations or local LGBT centers are offering free or low cost services virtually. So I know here in LA, the LGBTQ Center of Long Beach and the LA LGBT Center both have free virtual peer support groups and psychotherapy groups that people can tap into, and those are regardless of insurance. And two others that are housed on the internet So one is, there's an increase in the use of online therapy platforms like Talkspace or BetterHelp. Important to note that those are not free. So depending on what your financial capacities are, that could be an option for you to access something that is much lower cost. And many of them you can access kind of at any time through a text message or something like that. And then the other thing is social media. There is more and more really public dialogue about mental health and mental health recovery happening in the social media space, which I love seeing. So whether you're on Facebook or Twitter or any other social media platform, I might just search for mental health or depression, anxiety, and you might be able to find a group where you can really connect with other people in the social media space. That can be incredibly helpful.
Awesome, thank you. I learned something just now. I didn't know all that, so that's super helpful to anyone searching for a therapist.
Yeah.
So let's talk a little bit more about, or you had mentioned that there's a lot of uncertainty people are dealing with. So how do people cope with that? What are some tips you could give us as a psychologist for just dealing with this ongoing crisis that the whole nation and the world really is kind of involved in?
Yeah, definitely. I think the first thing that I would say to that is that the uncertainty and the distress that's associated with the uncertainty is completely valid and nothing less than understandable given what we are experiencing collectively within our society. There is a lot of uncertainty about the future, and these are unprecedented times. So I guess the first thing I would say is if you're able to tap into some sense of compassion toward yourself, toward having that uncertainty, that can really go a long way. And that your uncertainty and any kind of anxiety or depression that is coming along with that, that's a normal response to a really abnormal circumstance that we are finding ourselves in. And to know that you're not alone. So, certainly any of the resources that I mentioned a few minutes ago could be helpful to reach out for you or for you to reach out to. And there are also things that you can do on your own to help move through these really challenging times. So one thing that I often say to people is really think about what are the things in your life that are within your control. And I say this with the full acknowledgement that especially now, there is so much that is outside of our control. But there are these little things that we can exercise autonomy and agency over that can help us feel a sense of empowerment and our own wellness. These can be as straightforward as making sure that you have a daily routine. I'm not going to say what your daily routine should look like, but to have one that you use at least some days of the week. And to think about what brings meaning to your life right now. It may be that employment is not something that can bring meaning to you, either because you are unemployed or because you're employed in a sector that is not particularly meaningful. But what are those opportunities for achieving a sense of meaning through all this? So for some, that might mean diving into creative outlets that bring you joy and some fulfillment. For some, it is maintaining relationships, connecting with people either through Zoom like we're doing or over the phone. Or of course, if you live with people that you feel close to and safe with, kind of maintaining those relationships. Learning new information or a new skill, if that's something that's available to you. And the last thing that I think is especially timely right now on multiple levels is getting involved in some advocacy or social justice work. If that is something that fuels you, there are always so many opportunities for that. And there is increasing amount of research that shows that that can really be empowering and healthy psychologically for people to really engage in for themselves.
Awesome. Thank you so much for that.
Of course.
Yes, thank you. Definitely things that feel like creativity are amazing. And I want to jump off the point that you mentioned, working. One thing in Nicole research was through the William Institute and the work they do through UCLA. showing that LGBTQI plus folks are more likely to work in service work, food industries, or jobs generally considered essential work, who are more likely to be exposed to the general public. Some essential workers do not have the economic options to stay home during this time. And in your experience, what are some strategies that folks can use to deal with the anxiety associated with having to go to work and not having the option of staying in place?
Mm-hmm. Yeah. So I mentioned this earlier, but I would start with, again, considering what it is that you have within your realm of control, knowing that there may not be a whole lot, at least when we first start looking at it. Within thinking about what you have control over, then considering what is going to help you maximize your sense of safety. And when I'm talking about safety, I'm considering both physical and environmental safety. So that can mean any changes or amplifications you can make through your use of protective equipment or distancing, whatever is going to be the most effective harm reduction strategies to kind of move through this pandemic. And then we're also thinking about emotional safety and relational safety. So using different coping strategies that you know work for you to move through those moments where the anxiety is reaching a point where it's really starting to interfere. And also thinking about your relationships with people, looking at personal relationships that you have either in the home or outside of the home, and your professional relationships with colleagues. Do you have allies at the workplace that you can reach out to for support, whether they are kind of direct colleagues or supervisors, managers, etc. And also to consider what kind of support and advocacy do you have on your behalf within whatever industry or organization you're working within. So again, that can be through colleagues or supervisors. It may also be through your union. You know, are there things that you or your union can do to make sure that you kind of feel that maximum sense of safety given what we're experiencing?
Thank you. Definitely, like, keeping what you can control can really help navigate anxiety is what I'm hearing.
Mm-hmm.
And I'm going to follow up with another question, specifically looking at communities of color who may also be essential workers. Do you have any knowledge on how the pandemic has uniquely impacted people of color in Los Angeles?
Sure.
Or have you heard any reports of how COVID-19 is impacting LGBTQ people of color?
Yeah. Yes. And, you know, I first want to acknowledge that I am speaking about this from the perspective and experience of a white person. And so I cannot answer this from my own lived experience, but I can share what I know kind of intuitively and intellectually, and then also what I see and read from my colleagues and community members and family members. So, I mean, we know that LGBTQ plus Black, Indigenous, and people of color are disproportionately impacted by housing insecurity, employment insecurity, and financial insecurity or loss. And this structural discrimination was very much in place pre-COVID, and now our current pandemic has really just amplified the structural discrimination that exists within our society. We also know that Black, Indigenous, and people of color are disproportionately impacted by the virus itself. So as we're looking at both the virus itself and the systemic injustice and inequality that LGBTQ plus Black, Indigenous, and people of color have already been living through, we're thinking about this within a context of collective trauma. And we're thinking about trauma in terms of the pandemic itself, which is traumatic for all of us to differing degrees. And then, you know, we also really need to look at how anti-Black racism and the recent murders of George Floyd and Breonna Taylor, in addition to the many transgender people of color that are disproportionately murdered in this country, and really just within the past couple months. So Nina Pop, Tony McDade, and Rhea Milton, to name just a few. that these are kind of collective traumas that communities of color are being exposed to and maybe experiencing themselves. And that we are living in a society where we still need to convince people and consistently proclaim that Black Lives Matter, and that this, I think, is a public health pandemic in addition to COVID. So when we think about how this is all impacting communities of color, and especially LGBTQ plus folks who are people of color as well, I think we really need to keep in mind that these are kind of multiple traumas that are being experienced by communities simultaneously.
Great, thank you so much for that thoughtful response, Rebecca. We appreciate it.
Sure.
And thank you so much for being here with us today. Is there anything else you would like to add and let people know about services that are available, or any sort of final thoughts on what the world is going through right now?
So many thoughts every day, but what I will say is I just really, really appreciate the work that you're doing. I appreciate that we had a chance to talk today. And especially for folks who are in the LA area, stay tuned for what is coming from the Department of Mental Health for LGBTQ plus communities. We have a lot of work to do, and I'm really excited to take it on.